Hello, everybody. Allison at Pedigree, and uh, today is the first time we're going live. So I hope to make this a more regular event so that you can be a part of it. Um, Please remember to like and subscribe down below. Just a couple of things I'd like to cover firsthand. I am not a veterinarian. I do not claim to be one, and this information is not meant to substitute your conversation with your vet. Two, most of my information is from personal experience, being a business owner in the industry of grooming and pet care. But I am no expert. I have expertise from that experience, but I do not claim otherwise. I can potentially give wrong information as far as facts, and that would be due to not being corrected or having that information in advance. And I apologize, but I am always open to receiving the correct information. So do not hesitate to comment below, and I will go forward with that. So today, what I'm going to do, I've got some notes, and I'm going to go over what's kind of been happening recently with all of our pets, and a lot of people have been very confused, and just a little information that I'd like to share. Another note, I am not being sponsored. I do not claim to have any affiliation with any products. So any products that I may mention is due to, again, testimonies of clients and seeing the results firsthand. So without further ado, a mystery dog illness and what is it and what should I do? So there's a mystery illness that has affected dogs across the country recently and has spread to at least 14 states in the United States. The respiratory condition, which is yet to be identified, can be fatal. Please don't panic, everybody. I'm not saying your dog is going to get this if you reside in one of these states. This is just an information that we should all be aware of. First and foremost, before I go further into this, it is very important that you consult your vet and keep your dog up to date on vaccinations. Most illnesses are transmittable, not necessarily zoonotic, meaning going from species to species, and many respiratory illnesses that our pets can get are airborne. So in the case of a dog, having your dog vaccinated for kennel cough, which is its common name, but Bordetella shot is what you would tell your vet, is something that you should do every 6 months. Now, most people would say, well, I keep my dog at home, but that may be true, but your dog does go outside. People do walk down the street by your house. So bear that in mind. You go to doggy parks, you go to a daycare center, you take your dog to the groomer. Our grooming shop, our stations are 10 feet apart on center, so the dogs do not interact with each other. They are in the same environment, sharing the same air, but our facility, we require proof of up-to-date vaccinations for health and wellness reasons. And we use an air sanitizer and ozone rejuvenator in our facility to also combat any airborne viruses. That being said, what's the mystery dog illness? Veterinarians and scientists have yet to identify for certain the cause of the pneumonia-like illness, but there are common conditions, signs, symptoms for which you should be on the lookout for. According to the American Veterinary Acronyms, I'm horrible at them. AVMA. Here are the symptoms to be looking out for. And again, don't panic, talk to your vet. Chronic, mild, moderate tracheobronchitis, a sudden or long-term inflammation in the trachea and bronchial airways that barely or non-responsive, that is barely or non-responsive to antibiotics. So inside the throat, inflamed, trouble breathing. Sometimes people are thinking it's kennel cough and it's actually this. Chronic pneumonia with no response to antibiotic treatments. Acute pneumonia that quickly turns severe, and this type of pneumonia can be as short as a 24-hour period. Difficulty or rapid breathing, wheezing, dehydration, fever, nasal and eye discharge, weight loss, key things, weight loss, loss of appetite, and being lethargic. Anytime there is a significant change in weight, where there's loss, accompanying a loss of appetite and being lethargic, please, please, please get to a vet and have the vet look your dog over. That is even outside of the symptoms for this new illness. The illness can be detected in currently 14 states. It has been detected in these following 14 states: California, Colorado, Florida, Georgia, Idaho, Illinois, Indiana, Maryland, Massachusetts, New Hampshire, Oregon, Rhode Island, Vermont, and Washington. These are just a few where cases have been reported. The illness appears to be transmittable, and our guess is it likely affected more of the country if it hasn't already. For those who when I'm posting, more states could be having reports of this strange illness affecting our pets. How is the mystery illness treated? Dr. Marta Vilda Abrca, sorry if I said her name wrong, of PetKeen.com told USA Today the vets are concentrating on treating symptoms. Since the agent causing the infection has not been identified, the treatment is not aimed at killing any pathogen in particular. Vidal Abrca says, instead, the treatment is aimed at mitigating clinical signs and facilitating the dog's recovery. The types of treatments used to facilitate your dog's recovery is oxygen therapy, use of a nebulizer, which is a drug delivery device that atomizes the medication in a form of a mist so the dog can inhale it into the lungs, antibiotics to treat the secondary portion of the infection, and measures to ensure the dog has adequate nutrition and hydration, including the use of intravenous fluids. Now you wonder, how do you protect your dog from this mystery illness? The general advice from veterinary professionals is to minimize contact with other dogs. This means where it is possible. And this is why I said some of the things I did in the beginning of this video stream about what we do at our salon and things to kind of think about. The advice from veterinarians are avoid dog parks, avoid using doggy daycare or boarding, avoid grooming shops, use walkers or sitters who will take your dog solo, or grooming shops who will take your dog solo, or take a tour of these facilities that you are relying on. I'm not saying you should stop using your groomer and stop using your doggy daycare or your boarding facility or lodging facility. If you are unsure of their operation and their air purification, ask. There's nothing wrong. I don't see any business ever having a problem going through those things with their clients. We certainly do not. Make sure your dog is fully vaccinated, especially against kennel cough. Again, what is kennel cough? What is this Bordetella that a lot of places are asking for? Because Bordetella virus is airborne, you think of the vaccine like your human flu vaccine. It's to help the dog's immune system combat the virus. It's not going to stop the dog from getting it, but it will increase your dog's chances of being able to combat it and recover safely. Make sure your dog is in good general health. It includes a good diet. Please, if your dog shows any signs of respiratory issues, please contact your vet and isolate your dog from other animals. And if that is ever the case, also notify your other pet professionals, your dog walker, grooming facility, boarding facility. As I said, this is just some general information. We use a product called NuVet, or I should say we promote it in our salon and facility. And again, I'm not being paid by them or anything, and I will have a link below to where you can take a look at it on our website, should you wish. But NuVet is originally designed by veterinarians who wanted something for pets that were having chronic allergies, and they needed to get off of steroids. Steroids, as you may know, cause damage long-term to liver and kidneys. So the NuVet Plus was designed as an alternative, and it is all natural. Your dog could never overdose on it. There were testimonials of dogs getting into big bottles and things happening that turned out to be wonderful. When, of course, something like that happens, we panic, like, oh my God, you got all of these pills. It's designed to the body will absorb only what it needs and pass what it doesn't need through its urinary system. So what it does is it flushes the liver and kidney of toxins to boost the immune system naturally. So with this particular product, it can, for instance, say, my standard poodle has been on it since he was a puppy. So his normal dose for his weight and size is 4 tablets. And when the weather changes from summer throughout the fall into the winter, I up his dose. I actually double it. And just to help his immune system, because he is in the salon, he is exposed to more and other animals. There's more bacteria, there's more temperature changes, so I want to help him with his immune system. And then again, in the spring, when everybody starts getting more active and you have other allergies, there's external allergies like pollen and whatnot, this is again, help his immune system. The other added benefits to this product that I have seen is aid in digestion, better stool productions, more regular appetites, relief from itching and scratching, from external and internal allergies. And I can't emphasize enough, if with this new respiratory thing that's going around, it's never going to hurt to have something that's all natural that isn't going to hurt your dog, to add it to its diet and routine. And that's the thing about this NuVet. It doesn't interact with drugs that I have ever heard of or been witness to. Again, not a vet, always double check. You can always check with your vet about this product. But more importantly, if your dog is already on some medication and you are concerned about adding this, you can actually call the company. Go to the website, again, below, I'll have a link, and you can find out what they say. And you're not just a salesman. These people really care about what your questions are and whether there's any interaction. And then, of course, hey, get a second opinion, talk to your vet too. Give your vet the information that you will find from this link below about the product. A lot of vets in our area are now aware because for 14 years I've been promoting it with my clients, and there is now 3 vets in the area who are now also carrying it in their facility and promoting it to their client bases. So just to kind of recap, if you liked the information, please, please, please like, share, and follow us. Again, this is our first live feed, so I am going to work on doing this more often and getting more frequent with some of our more educational posts, and I will go over other things. But I hope you liked it and you found it informative. Please give me your feedback. Like, share, hit the bell, and the product that I mentioned, it will be in the description so that you can also check it out there. Thank you again, and we'll have a perfect day.